What is dystocia? Have you ever wondered what happens when a pet has trouble giving birth? This condition is known as dystocia, and it can be quite serious. Dystocia refers to a difficult birth or the inability of an animal to expel the fetus through the birth canal without assistance. This issue is common in veterinary medicine, especially among dogs and cats. Dystocia can arise from several factors. Sometimes, the size or position of the offspring can make it hard for the mother to deliver. Other times, there may be abnormalities in the mother's reproductive tract or issues with uterine contractions. So, how can you tell if your pet is experiencing dystocia? Symptoms can vary, but there are some key signs to watch for. If a dog has a gestation period longer than 70 days, that can be a red flag. Another sign is if the mother has strong, persistent abdominal contractions for more than 30 minutes without delivering any puppies. Weak contractions lasting over 2 hours without delivery are also concerning. Additionally, if you notice abnormal vulvar discharge, like bloody or greenish discharge, it could indicate dystocia. Diagnosing dystocia involves careful observation. If labor has not started when expected, or if there are long intervals between births, these can be indicators. Veterinarians may use diagnostic imaging and blood tests to confirm the condition and check the health of both the mother and her offspring. When it comes to treatment, there are two main approaches: clinical and surgical. Clinical treatments aim to assist the natural birthing process. This can include stimulating contractions with a hormone called oxytocin, repositioning the offspring, or using lubrication and gentle traction. However, if these methods do not work, a cesarean section may be necessary. This surgical procedure is often essential to ensure the survival of both the mother and her puppies or kittens. The prognosis for dystocia can vary. Generally, if a cesarean section is performed promptly, the outcome for the mother is fair to good. However, it is important to note that dystocia can happen again in future pregnancies. The prognosis for the offspring is also fair, but there is a risk that some may not survive. In veterinary practice, monitoring pregnant animals closely is key to identifying signs of dystocia early. Timely intervention can significantly improve outcomes for both the mother and her offspring. Veterinarians must be ready to perform cesarean sections when needed, as this is often the most effective way to manage dystocia and ensure a successful delivery.